Hello everyone, my name is Dr. Urvashi Pachel and welcome to my channel. Let me introduce in brief about myself. I have completed my MBBS and my post-graduation in MD in a subject called as Pathology from a college, Rajiv Gandhi Medical College in Thane, that is near Mumbai. So in my channel, I will be talking everything about the academics, about preparation of various examinations, about health, nutrition in general, and about lifestyle. So stay tuned, it's going to be a very exciting journey. In today's video, I will be sharing my entire experience about how I have cleared the toughest exam in my life, that is the MD examination. So I will be giving very raw and clear tips to all the students out there preparing for any kind of examination, which is not just related to the medical faculty, because ultimately exams are exams and the baseline strategy somewhere remains the same. So the first and the foremost thing is a brief thing about what is MD. MD is basically master's, a degree which is achieved after MBBS. So I secured this MD in Rajiv Gandhi Government Medical College post my MBBS. I had given an examination called as NEET PG, through which I got this college. And pathology was more or less a kind of branch that I had always wanted to, because I had a soft corner from the starting for pathology. And then later on, the residency was also quite tough. I will be sharing a very separate video about the residency. As residents, we work and what we do exactly in the college and the hospital, how we deal with the patients, and what exactly is pathology as a branch about. Recently, I had finished my MD examination in the month of November and the results are out. I had secured 65.12% in my MD examination. Let me share a few tips about how I have prepared. First and foremost, right from the starting, that is PG is about 3 years, and in the first year of residency it is usually very difficult to manage work along with the studies. So the first year is usually gaining experiences, understanding what the subject is about, because as a pathologist, what I perceive this subject now, I did not know that in my first year. And in the MBBS years, though we have this subject in our second years to study, but not as a postgraduate. And the entire thing was different when I became a resident in pathology. I got to know so much about the subject, which I hardly knew in my MBBS years. MBBS years may we just study the books and that's it, and we feel this is all about the subject. But actually, when we work in that department for the entire 3 years, we get to know the enormity of that subject. So my first year was not much of academics oriented. I had worked in the department, we had calls, and moreover, our batch was the COVID batch for 2 years. So we did not have any juniors for 2 years, and we were just the first year residents, 6 of us, working entirely in the COVID. We had rotations and COVID duties along with the departmental duties. The second year, pretty much, we had started studying with the academics. We were oriented with the subject, and we got to know which books we have to read, what kind of references we have to use. I would say that the proper prep started from my third year. So how in the third year I prepared for my MD? First and foremost, there is a thing called as thesis that every MD candidate has to finish. It is like writing an entire book about a specific topic that you have selected. You have to write the entire thing right from the start to end, maybe around 200 to 50 pages. You have to take real sample size, real samples, and you have to relate with the findings and the results. So there was a thing called as thesis, which took 3 months of my entire third year. I was engaged in thesis. So leaving that part of thesis, I had almost studied more or less every day or every alternate day in my MD. The MD examination prep started in a full flow in the last 3 months. When I had finished submitting my thesis, I was done with all the basic academic like posters, papers, publications and all that. So I started the full-fledged studying in the last 3 months. So this is a very raw and a clear thing, it's nothing about like I'm a last minute student or like that. But in the entire 3 years, while you're working, you hardly have any time to study. And if you study for 1 or 2 hours, I wouldn't say it is a full-fledged study. In the last 3 months, I would say I used to study almost around 8 to 10 hours every day. My morning routine would be like, I used to wake up at around 8 o'clock. I have a small baby, so my nights are not very good. I usually have to wake up in every 2 hours for the baby. She's 15 months old, and along with the baby I had to study also. So unlike other guys, I didn't have the privilege to have a sound sleep of 6 or 7 hours and then wake up fresh and study for the whole day, and not like that. So I used to wake up around 8:30, and I used to start my study around 9:30 or 10, have my breakfast and start the study. So the first thing I would suggest for all the students, is that plan your day well ahead. Like the night before the day, you need to plan what are you going to study tomorrow, at what time you will start in the morning, and what are your goals and targets for that particular day. Unless and until that vision is clear, you might be randomly studying anything, and you might just end up doing nothing. Or even if you have studied, it won't be a systematic study. So a very basic thing of all the students preparing is you have your own personal journal, and in that journal you just write down a small step, that is what are you going to study the very next day, how much time is that particular topic going to take, and what are your targets for the entire day. And ultimately by the end of the day, you also have to write how much have you achieved out of it. I would say not every day it is possible to achieve 100% of what you have studied. It is completely okay. We all set our goals way beyond our actual capacity, and that is fine. I think your goals should always be beyond what you're thinking, so that you might get a little bit closer to it. I would always have a written note of what I'm going to study the next day. So that was the planning that I did a night before. And apart from this, I had planned my entire 3 months, because in MD involves having 4 papers. Okay, so very briefly I'll tell you. Paper 1 is general pathology, paper 2 is systemic pathology, paper 3 is hematology, and paper 4, that is recent advances, which actually the paper 4 is supposed to be the toughest, because there's no specific syllabus or any book that you have to read for paper 4. Basically my target was that within 2 months I have to finish the entire first reading thoroughly, along with the notes, along with basically last 10 years question papers. So last 10 years university question papers are supposed to be very important IMPs that you have to know through and through while appearing for the theory examinations. So what I did was that I had written all these notes, and even if I haven't made the notes out of those topics, I had an entire sheet printed, and in that sheet I had written key from where I have to study this question, from the name of the book, and besides the book I had written the page number. So, and in the last moment, I just know that this topic I have to open this book, this page number. So it was very easy for me to revise a day before the examination. So I had this whole entire sheet with the questions, around 100-200 questions written along with the page number and the book name from where it has to go. So that made it very easy for me for last minute prep. I just used to pick up that sheet. I used to see which question I have to read, this I have missed, or this is a tough question, I need to revise it mandatorily. Just opened and that's it. Because I have seen so many people, we being an MD student, we are referring so many books, and it's not possible for you to remember every topic from which book you have read, and almost all the topics are haphazardly given here and there. So it is always better that you know that this topic has been read from this book, and you stick to that particular book till the end. Don't refer to any kind of new books in the last minute of your prep, because you have a photo memory of that particular page and that book while writing the examination. What will happen if you refer 10 books for one single topic now? Then at the end you will be confused ki, from here it's given something else, here it's given something else. Don't be like that. Or else what you can do is compile the data of all the books in one single book, just make notes out of it or stick some stick-ons, and it will be a better idea. So the first reading was pretty much very difficult, lengthy, and it was about making notes of each and every topic, writing the IMPs and making flowcharts and the diagrams and all these things. So very tedious, very boring for I think 2 months. Out of the 3 months, the 2 months went in this first reading. So the last month was left. So in that I had decided that 5 days I will give for each subject. So I started again. So that that completed the 20 days. And in the last 10 days, what I did was ki 3 or 2 3 days for the last third revision, and the final revision that happened was before the examination. So raw thing is that plan your months, not just your months, plan your weeks and your days and your hours. How are you going to do it? Do a journaling day before it. That is what we get to know from this. Do a journaling at the end of the day. Write down that this topic is left off today and try to cover it in the next day. Okay, so this was the tip number 1, that you need to do a planning and a journaling. Tip number 2, I would say, is a short-term revision. What is a short-term revision? That in a week or so, if I have read the topic, I would, after a week, maybe the 7th or the 8th day, I would end up revising everything in a short span of 3 to 4 hours. I would just turn the pages of what I have read in that 1 week. So that used to polish everything inside my brain, that whatever I have read fresh, it used to get polished. What happens is, generally in medical, already it is so volatile and you end up reading everything at so molecular level that the chances of forgetting it are very, very high. So how do you avoid forgetting a topic is by revising it as early as possible, as like maybe in a week. I know it is very difficult and we are like, I don't have time for revision, there's so much of topic left to cover, and the time for paper 1 is just going to end. But this thing helped me a lot, that I started doing was to revise in 3-4 hours what I have read in the entire week. So that would really make that topic very strong of me. And the second benefit that I gained out of it was to know that which topics are there that I tend to forget. So there are many topics, especially the classifications that we have, enormous classifications, WHO classifications in pathology. There are molecular markers, there are IHC markers. These are the things that are very volatile and you tend to forget, and for that you need multiple revisions. So this 7 days or 8th day pay, what I used to revise, I used to dedicate a day or maybe a half day, depends on how the syllabus goes, and I used to revise the entire thing. Make sure that while revising this thing, you don't end up reading each and every line. Okay, so what you have to do is, it's called as a rapid revision, and the rapid revision, the word itself states that you have to just read the highlights or the things which are difficult to memorize. See, the human nature is that we tend to read again and again the topics that we know because you find it interesting, but what you will gain out of it now, ultimately the difficult topics or the things which are difficult to memorize, that you have to go through it again and again. So this short revision gave a benefit at the end to me, because ultimately while having the first read itself, I ended up revising it 2 or 3 times. So I wouldn't say it as my second or third revision, but a short revision which was very much helpful in the end. And one more thing that you can do is while reading, if I'm reading some topic and then I'm switching to another topic the next day, another topic the next day, I might in the process get something to know about somewhere, some topic that I have read in my first day, something more, or like something more about that first topic. So that also is the benefit, that you end up writing that notes in that revision wala day about the topic that you have gained more information about. So that is the tip number 2, that you do a short revision. Okay, the tip number 3 is managing your entire time. How do you manage your time of the day? So human brain has a capacity to hardly sit and study for half an hour or 1 hour. You might end up getting fatigued, distracted, and that is perfectly normal for everybody. So what I used to do was, in the morning hours when I'm very fresh and I'm not exhausted and I'm very much motivated, I used to pick up the topics which are very difficult or high yield topics, or the topics which requires a lot of concentration. So my first seating that involved before the lunch, where I was fresh, not sleepy, motivated would be the topics which are tough, and it was always like in a go I would study for 2 or 3 hours with full concentration, and at the end of the third hour I would be fatigued and I was like, no, 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 I need a break. So what happened was the most difficult part of the day is covered in the morning, and you are left with the easy topics for the evening. So by the time the evening comes, your brain is also fatigued, you are physically tired, you are exhausted, and a little bit of motivation is also lost. And you tend to pick up your phone, you tend to see the social media, you want to go to sleep, or you want to take a nap, you want to eat something, you want to go out. So that is fine, but the topics left in the evening are something like which can be easily, smoothly read by, just I used to take a walk in the corridor reading some topics, or just see a video of a topic and memorize it somewhat, or just have a simple discussion with any friend or my brother, like that, so that that part of the day is utilized for some other easier topics. So that is also a very important thing. The first half of the day is reserved for the very difficult ones, and the second half of the day is reserved for the topics which are comparatively easy to understand and memorize. I would always take a break in the afternoons after my first session, which would kind of reset my brain. So what was the benefit of taking this break in the afternoon? I would have my lunch at around 1:30 or 2 o'clock, and for an hour or so I would just take a nap, or I would see some videos, or I would see a short movie or something like that, which would regenerate me. Why this is important? Because at a stretch, if you keep on studying, the capacity to understand that is lost. Okay, you don't have to just keep your book in front and just see constantly and call it as I'm doing a hard work. It's not like that. Ultimately what matters is how much you're gaining out of that. If you're studying for 2 hours, make sure that the 2 hours are the most productive 2 hours, so that you are completely focused and make most out of it. Tip number 4 is about how you manage a day before your exam. So day before your exam is the day in the highest anxiety. I personally am a person who gets very anxious during the exams. I'm completely sleepless, I don't eat properly, and I just want to read as much as possible and cover as much as syllabus I can, and I'm like constantly saying, if this comes, what, I haven't studied this, or I don't know this topic properly. So I am usually a person who is in a panic state a day before the exam. But you don't have to be like me. You have to learn how to manage this anxiety and study with full focus and be calm during the examination. So a day before the examination, I would suggest that just turn the pages of the books. And really, this is the fact that even if you don't open your book the day before your exam, and if you have studied in the last 3 months dedicatedly and properly, you will end up getting good scores in your theory examinations. It doesn't matter. The last day prep doesn't matter. It is just a psychological satisfaction. So many people are there who a day before the exam, they have some health issue or something like that, and they are not able to study that efficiently, and they still manage to get good scores in that paper. So that is completely fine. So a day before the examination, you just have to turn the pages, read the highlights, or just go through the notes once. Take proper sleep of, I think, 7 hours, 8 hours also if possible. There's no point in being sleepless and insomniac and going all exhausted in the theory papers and writing in all that mental state where you are already exhausted and you have to write a 3 hours, 2 hours paper, or moreover that you have to recall everything. So I would suggest take a nice sleep at night of 8 hours, eat something nicely before the examination, and then with a pray to God. Most importantly, I would say pray to God and take blessings from your parents, from your family members, from your elders, from your teachers, and then go to the examination. I had this habit of every day going to my teachers and just taking blessings from them and praying to God, and then going for my theory examination. examinations, I think that calmed me down so much, and I used to become less anxious. I used to feel very positive, and feeling positive, and the thing that my a very good thing that my teacher had taught me, that believe it is possible and you're already halfway done. So I always kept repeating this thing in my mind, that I have to believe that the paper is going to be good, I'm going to write everything, I'm going to remember everything, and I'm halfway done. If I am positive about that examination, that is going to have a positive outcome. If I am negative, nothing can stop me from screwing that thing. Tip number 5 is, how do you actually write the examination? So writing an examination is a skill, okay? It is a skill of presentation. When you get the question paper, spend at least 1 minute, if not so 30 seconds, reading the entire paper properly. Read the questions nicely, read the entire paper right from question 1 to the last question, and just close your eyes and try to memorize, okay, that, and say positive this thing, that this paper is very nice and I'm going to attempt it properly. So that is a very important thing. So whenever I had that paper in my hand, immediately as the examiner invigilator used to give me the paper, I used to read the entire paper. I used to say to myself that yes, it is a nice paper, I have read everything. Even if I don't know a topic or two, that is fine, but most of the paper, say 80% of the paper, I have read it, I know, and I'm going to attempt it very nicely. This was the thing that I used to say, the very first thing that I said to myself after receiving the paper. So that in turn gave a positive thing to me. Managing time in those 3 hours of writing theory is also very important, because for me, in my first paper, it was like, first paper is a first experience. So it was like, I went on writing and writing and writing, and ultimately for the last question, I saw I had hardly 10 minutes left to attempt that question. And in spite of knowing that question so well, I couldn't attempt it nicely, just because of the ill time management of that paper. So in paper 2, I decided to have a very nice time management, so that I would be able to attempt each question nicely. So stopping also is an art, where you need to stop, and what you need to write in that paper is very important. So for that, there is tip number 6. The tip number 6 is that when you see a question, okay, you just try to focus on 10 highlighters that you have to write in that question, okay? And those 10 highlighters will be the things that have to be compulsorily written, irrespective of anything. Apart from that, if you miss out due to the time lag, that is completely fine. But that 10 highlighters are very important. So as soon as you see a long question, just memorize that this 10 things have to be there and start writing them. And give a particular time for particular question. Like for the long question, maybe give 45 minutes or 40 minutes. For short question, give maybe 20 minutes, like that. It is person to person, it is completely subjective. So that was my tip number 6, that how you need to manage your time during the theory examination. So guys, this was pretty much of how I had prepped for my entire 3 months of my MD examination. MD is the like what I would say was the most toughest examination that I had given after NEET PG. NEET PG was also tough, but it wasn't like this, that you have to write the theory. It was MCQ based, and the pattern is quite different for studying in that. Here it is like, and a branch like pathology, it is so vast, it is so volatile, you have to know everything about everything. So I pretty much secured a decent score, that was 65.12%, and I'm happy with it, and I will be sharing so many more videos with you in the upcoming days. Suggest me in the comments if you want to see any specific topic, and I will be back with the kind of videos. Suggest me if you think that I need some improvement in the videos. That also, I'm new to this channel, I'm trying my best that I can do. So that is pretty much about it. Thank you so much guys, see you in the next video, bye.